Welcome everyone. I am Dr. Keita Javed, the ambassador of Hype Medical Academy in the Central Asian region. Hello, now I'm audible? Hello?
Yes,
Yes, you are audible,
Akidat, we
yes,
can
yes.
hear you. Please go ahead.
Okay, so welcome everyone. I'm Dr. Keita Javed, the ambassador of Hype Medical Academy in the Central Asian region. Thank you all for joining us today for this exciting webinar. We all are here to empower you with the knowledge and strategies needed to excel in your upcoming exam. But before we dive in, I want to remind you of our special offer. Get free access to 5,000 latest PLAB MCQs in just 3 simple ways. Yes, you heard it right. In just 3 simple ways, you can get 5,000 latest PLAB MCQs. So what you guys need to do is go to website of hypemedicalacademy.com, register with your name, email address, and contact number, and then go to our YouTube channel, subscribe, and take a screenshot. And after taking the screenshot, you have to send that screenshot via the WhatsApp on the number that is given below in the chat box. And once we receive that, our administration team will send you the login credentials for free access to those MCQs. So let's get started. And today I'm thrilled to introduce you all to Dr. Umar. Dr. Umar have 15 years of clinical experience of working in NHS and 10 years experience of teaching medical students, foundation year 2 doctors and GP trainees as well. He have got a lot of experience with examining techniques, and today Dr. Umar will be sharing his insight and expertise with us. But before we begin, I just want to give you a reminder that you can jot down your questions as we go along, because after that, Dr. Umar Insights on UK MLA, we will have a question and answer session. So, Dr. Umar, thank you so much for taking your time out and for making up to this time. So, without any delay, I would like to hand over the mic to you. And once again, Dr. Umar, thank you so much. Your time means a lot to us.
Thank you, Akida. Thank you very much. Thank you, everybody, for joining. Thanks to the whole team for setting this up. It's a pleasure to be able to teach and to communicate and meet new people. So the pleasure's all mine. Thanks again. Can I just check that the presentation screen is visible and I'm audible and there's no issues with audio or video, please?
So your audio is perfect on my side, and screen I think is visible.
Okay, brilliant.
Rest everyone,
Thanks.
you can get in chat box.
Yeah. If there's any issues, let us know. But if not, we'll go ahead. Okay, so first of all, as we always do, guys, please drop a message in the chat box. Let us know where you're from. I'll start. People are always shy. I'm not sure why. So it's a good way to just have a bit of an icebreaker. We'll find out who's on the webinar, where people are joining from. Chennai, fantastic. Welcome. India, Hyderabad, fantastic. Brilliant. Everybody else, please drop a message. Where are you from? Just gives us an idea about where people are, if there's any particular issues that people might have from their particular countries or regions. So a couple of people from India. I know we definitely have some people online from Pakistan as well. And obviously we have some, oh, fantastic. Yeah, Stockport. Brilliant. Fantastic. So we've got people from the UK, Pakistan, and India. Fantastic. If there's anyone else, just drop a message in there. Let us know where you're from while I'm having a chat. So brilliant. Welcome. Thanks again. Let's get started with the introduction. So what is the aim of today? So today Our learning objectives are to give you some PLAB 1 preparation tips. So obviously we'll give you some advice about how to prepare. We're going to discuss some things about how to approach PLAB 1 questions. Obviously, it can be intimidating if you're just starting out. You might be very experienced. You might have done hundreds or maybe thousands of questions, but still, it's always useful to get a bit of a boost, get some advice, and hopefully keep your preparation going. So they're the main aims of today. Obviously, we will have options for question and answers at the end. So if there's anything you want to ask, please save it until the end, or feel free to, drop the question in the chat box. The team will keep an eye on it and we'll go through them if there are any at the end, or at the end, just, unmute yourselves when we ask and we'll go ahead. So we're going to dive straight in after the introduction to speak about some study tips, to speak about how to approach MCQs. And then we're going to go into actually doing some practice questions together. And that's obviously the part that I think most people will be most excited by. And obviously, as we've said, there'll be question and answers at the end. And Dr. Akidat has already mentioned our fantastic offer of access to our question bank. Don't worry, everybody who has registered will be sending you an email early next week on Monday to explain what you need to do. Right. Okay. So let's get started, guys. So PLAB 1 study. Okay. So as you guys may or may not know, it's a huge curriculum. There's lots and lots of conditions, lots of diseases, and lots of other things to cover. So we always encourage you guys to plan before you start anything. Otherwise, how are you going to make sure that you cover everything in the time period that you have? So we talk about this study cycle, this plan, study, practice, and analyze. So you'll plan, first of all, you'll have a look at what kind of things you need to cover. If you need some individual help from us in how to put together a study plan, that's perfectly fine. That's what we're here for. Then once the plan is in place, obviously you need to do the work, you need to study, you need to revise. And then once you have, once you've started studying and then your knowledge is improving, of course, you need to practice, because PLAB 1 is an MCQ-based exam. And until you practice, until you actually have a go at some of the questions, you're not going to know how you are doing. So you need to practice, and then you need to analyze. You need to look at which areas of the curriculum, which types of questions, which specialties, which particular body systems you are struggling with. You analyze that, and then you go back and you adjust your plan, and then the cycle continues. And this cycle is continuous. You need to do this throughout your PLAB 1 preparation, and obviously we're there to help you guys as well. Few other things, obviously, just to mention is when you're coming from abroad, you're coming from outside the UK, of course, you have lots of medical knowledge, you may have lots of experience, but you need to get the correct knowledge. You need to know about the guidelines, you need to know about the specific drugs, you need to know about the approach to medicine in the UK, which is inevitably going to be different from what you are already used to. So the knowledge part, of course, is crucial. Couple of other things, learning styles. Learning styles are really important. Not everybody thinks about them, but if you want to optimize your retention and your study, you need to have an idea about your learning style, whether it's visual, whether it's audio, whether it's using mind maps or whatever it might be. You need to try to get some understanding of that as well, and that will feed into your study plan. And again, this is something we can help you with if you come along with us. We can help you do that. And the final thing is, of course, exam technique. So there's lots of parts to success to PLAB 1. There's your planning, your actual study, how you practice, how you analyze, how you feed that back in. Learning style is important because you need to optimize that. The knowledge, it has to be the correct knowledge, and exam technique. You can do all the correct preparation, but if you don't have good exam technique, or for some reason you have a poor performance on the day, obviously you are going to struggle. So we're going to cover the exam technique a little bit in the webinar today as well. This is not a comprehensive guide, it's just an introduction, and then we'll go into all of the questions and have a go at them. So just a few basic tips about how to approach MCQs. As I said, this is not comprehensive. We can't possibly cover all important exam technique in just a few minutes, but these are three key things, absolutely key things that you need to be used to and you need to have a good grasp of. The first is when you read the question, you need to think to yourself, what is being asked? What am I actually being asked? You need to make sure you read it properly. Often what we do is we do skim reading, you miss words, or you think or you read something as something else. And so your understanding of what the question is saying or asking is incorrect. And so the answer you give is going to be incorrect. It sounds simple, but it's extremely important. Now, how are you going to do that? You need to highlight the key points. You need to highlight them mentally. If you're able to do it, in another way by scribbling, whatever, that's fine as well. Make sure you highlight the key points that are relevant to the scenario. Don't get distracted by irrelevant information. Sometimes the scenario is full of stuff that isn't relevant to the question. It might be relevant to the story, but it's not relevant to actually helping you answer the question. So make sure you understand what's being asked. You can only do that if you read the question properly. Take your time, highlight the key points, don't get distracted. And the final thing is time management. Now, time management is crucial. As you know, there's 180 questions, 180 minutes. That is an average of 1 minute per question. It's not a lot of time. And so, of course, if you find yourself struggling, you don't get you don't feel you're getting somewhere with a question, flag it and come back to it at the end. Don't spend more time on it because you might miss out marks later on when you are confident about things because you just didn't get to answer them questions. Okay, so just some study tips there, some advice about how to approach the MCQs, and let's just get going with the main part, which is having a go at some questions. So what we'll do is I'll read out the question. I'll give you guys a minute, and then I want you guys to pop in your answer into the chat box. And don't be shy. Have a go. Remember, guys, it's a safe space. It's all about learning. And if you get some of the mistakes out in the preparation, that's the most important thing. So let's get going with this first one. A 24-year-old woman was prescribed azithromycin for a sexually transmitted infection. She has been using a form of contraception for the past year. Which single contraceptive method listed below is most likely to be affected by azithromycin? So the options are Mirena coil, IUCD, progestogen-only pill, combined oral contraceptive pill, or none of the above. Thank you, Hafijuddin. I'm not sure if that's your name, but if you say that correctly, thanks for your answer. Everybody else, have a go. Please put your answer in there. Take a minute if you need to. Have a think about it. Put it in there. It's a nice, simple one to start with. Nothing too complicated or scary, just to highlight some important points. It's a useful question. Have a go, guys. Please put your answer in there into the chat box. Come on, don't be shy, guys. Okay, fantastic. We're getting some participation. That's great. Thank you. Okay, so we've had a host of a range of responses. E, none of the above. D, B, and E. Okay, brilliant. Brilliant. Thank you. Right. Okay, fantastic. None of the above. Right. Okay. So let's have a look at the answer and then we'll chat through how that is the correct answer and why the other ones are incorrect. Okay, so the correct answer is E, none of the above. Fantastic. Well done, guys, who got E. For everyone who put other answers, don't worry. It's perfectly fine. Let's have a chat about what the question was actually asking. So let's have a look at doing what we said. Okay, so read the question properly. 24-year-old woman, her age isn't relevant here. She was prescribed azithromycin for a sexually transmitted infection. That's important. She's been using a form of contraception. Which of the following is likely to be affected? Obviously, so there's 5 options. If you read them, you'll see, and you should remember, so obviously you need to apply the knowledge as well, but you may remember that the pills can be affected by certain antibiotics, the combined pill in particular. So you might have been tempted to put the combined pill, or maybe you might have been tempted to put the progesterone only pill. I don't think anybody said C, but 1 or 2 people said D, I think. So that is understandable, and that's an easy kind of mistake to make. However, what you do need to this question is a good indicator of how, you know, it's not just about doing lots and lots of questions. That's not going to make sure that you pass the exam, because you do have to have some knowledge as well. So you'll remember it was previously thought that certain antibiotics, the hepatic enzyme inhibitors, like azithromycin, may affect the contraceptive, the combined oral contraceptive pill. So this was thought to be the case up until a few years ago, but it was later discovered that there's no significant interaction, and so the now it's only some anti-TB drugs like rifampicin mainly, and a couple of others that can be affected. And so actually the correct answer is none of the above. So you could have used a method of elimination. You could have thought, okay, so the Mirena coil, the IUCD, you know, I can put that, I can rule them out if you knew that the combined pill can be affected. And then, you know, you could probably rule out progesterone only pill as well. And then you would have to decide between combined oral contraceptive pill or none of the above. But obviously, as we've said, you need to have that little bit of knowledge that now that is not the case. And so the correct answer is combined oral contraceptive pill. So well done, everybody. I think most people got that answer correctly. If you didn't, don't worry. You'll hopefully have taken something from that question. Okay, fantastic. So let's move on. Let's have a look at the next one. Okay, so this is more of an acute one. So a 24-year-old man presents to the emergency department with 40% partial thickness burns. His pulse rate is 105 beats per minute, and his respiratory rate is 25 breaths per minute. His systolic blood pressure is 80 millimeters of mercury. What is the single most appropriate management? So the options are IV fluids calculated from arrival time to the emergency department, IV fluids calculated from the time of burn, C, oral rehydration, D, intravenous dextrose, and E, ointments. So take a minute if you need to, guys, and drop your answer into the chat box. I can see there's a couple of attempts already. Please, everybody else, have a go as well. That's it. Fantastic. That's great. The more you participate, the more you will benefit from the session, because then we can address your particular answers, you know, specifically as to why that isn't correct. And or you can even, you know, you can even drop something in there once we're explaining about why you think that was correct. Okay, so we've had a few responses. Anybody else? Another 10, 15 seconds, and then we'll have a chat about the answer. Okay. Right. If everybody's had a go, let's have a chat about this question. So before we move on to just look at the correct answer again, I just want to highlight that thing we said about reading the question properly. So 24-year-old man, again, his age isn't really relevant to this question, but he's presented to the emergency department. So he has 40% partial thickness burns. That's obviously important. His pulse rate is 105 beats per minute. Respiratory rate is 25 breaths per minute. So they are both abnormal. His systolic blood pressure is 80 millimeters of mercury as well. So these are the key things that you need to notice. Is somebody with significant burns, and it looks like that there is definitely some hemodynamic instability there as well. Okay, so that's what you should have noticed from the question. Let's have a look at what the correct answer is. So the correct answer is B, IV fluids calculated from the time of the burn. Okay, so let's have a look at the question again. So you've got a gentleman with significant burns, 40% partial thickness burns. He's tachycardic, he's tachypneic, and he is hypotensive. His blood pressure is low. So using them pieces of information, there are certain answers that we can rule out straight away. C, we can rule out straight away. It's not appropriate, is it, to give oral rehydration to somebody who's hemodynamically unstable, even if we don't know about how to manage burns in particular. We have E as well, ointments. Are ointments going to help somebody who's got 40% partial thickness burns and they are they are hemodynamically unstable? Absolutely not. Remember, it's asking for the single most appropriate management. There might be certain things that are other things that are done as well. However, these two straight away are not going to be appropriate. So then we're left with three options. We have IV fluids from the arrival time to emergency department, IV fluids from the time of the burn, and then we have intravenous dextrose. So, okay, now we have to decide what, even if we're not sure about particular management, does this person need IV fluids or does this person need IV dextrose? I would most confidently suggest that someone who's hemodynamically stable, we're going to go to IV fluids. So then we're left with two, A and B. Now, choosing between these two, you will either have to take a 50% chance and have a guess, or, which is one of the points we're trying to highlight, is that you do need knowledge to answer these questions correctly. You will need to remember that when you're treating burns patients, you use something called the Parkland formula. So the Parkland formula, we won't go into it in too much detail, but it's 4 times body weight in kilograms times total body surface area affected, which obviously, some of that information you don't have here. But one of the key parts of the Parkland formula is that you calculate, you actually calculate the amount of fluid that you, the time that you're going to give this fluid over, which is normally 24 hours. You calculate it from the time of the burn, not from the time of arrival to emergency department. And that makes sense because somebody might have had a burn 7-8 hours ago, but they didn't get to A&E until just now, or they might have only just had the burn now and they came to A&E immediately. So it makes sense to use the time from which the burn occurred. Okay, so that's how you work. Look at the question, look at the key features, deduce what the question is, what the information is telling you, and then what the question is asking, and then obviously work your way through the answers. So just a couple of other quick things on the Parkland formula, just as we're on it. So we might as well have a quick chat about it. So you give the first 50% of the total volume that you've calculated. Remember, you use that formula that we're just speaking about to calculate the volume that you're going to give over 24 hours. The first 50% of the total calculated volume you give over the first 8 hours. And again, is from the first 8 hours since the burn, not the arrival at hospital. And then you give the remaining 50% of the volume over the following 16 hours. And it's normally crystalloid initially. So that is how we tackle that. That is how we dissect that question. And that is how we get to the right answer. Hope that was helpful, guys. If that's all okay, let's move on to the next one. We are rattling through these very quickly, but that's just because there's quite a few questions. You'll benefit from having a look at lots of different types. Okay, so let's move on to the next one. Right, so we have a 33-year-old beekeeper who gets a rash over her whole body every time she is stung by a bee. She may have 2 or 3 bee stings a year. They result in an itchy rash that starts a few hours after a bee sting and resolves in a few days. She suffers from severe eczema, which she has had since she was a child. She was also told by her parents that she had multiple food allergies when she was young, which included strawberries and mangoes. What is the single most appropriate piece of advice? So the options are A, carry an adrenaline auto-injector, B, use oral antihistamines to reduce the itch when the rash develops, C, use antihistamine creams to reduce the itch when the rash develops, D, use intranasal steroids when the rash develops, and E, call 999 for an ambulance immediately when stung by a bee. So feel free to have a quick read of it yourselves, as obviously in the exam, you're not going to have it read to you. You're going to read it yourself, but have a go, have a think, drop your answer in the question, and then in a minute or so, we'll have a chat about the options. Thank you, Manash. Thanks for the contribution. Thank you, Mars. Fantastic. Keep the answers coming. Thank you, Hafijuddin. Brilliant. It's always makes a webinar much more exciting when everyone's interacting, when people are engaging with the questions. Thank you, Fatma. Okay, so we've had a range of answers so far. Anybody else? Give you another 10 or 15 seconds to have a go before we have a chat about it. Okay, brilliant. Thank you, Asfan. Fantastic. Right, let's have a look. So what I'm going to do is let's look at the correct answer first. So the correct answer is B, use oral antihistamines to reduce the itch when the rash develops. So well done, everybody who got B. Don't worry, guys, whoever gave a different option. Let's have a look. First of all, let's have a look at employing them couple of things that we said about exam technique, and then we'll move on to discuss the answers. So let's read the question properly. Let's highlight the key points. Again, 33-year-old beekeeper is not important. As long as it's an adult, that's all you need to know. So she gets a rash over her whole body every time she is stung by a bee. Now, whether she has 2 or 3 bee stings a year or 15 or 20 doesn't really matter in terms of helping you decide the answer. So, don't get too hung up on that part. When she gets stung, she gets an itchy rash that starts a few hours after the bee sting and resolves in a few days. So that is an absolutely key piece of information. There's other things as well. So she suffers from eczema, which is had since she was a child. That just tells you that there's some atopy there as well, and that she had multiple food allergies when she was young, which included strawberries and mangoes. Again, just adding to the atopic kind of picture. So what you need to do when you read this question is obviously the the way we're trained as medics is we're trained to pick up red flags straight away, and we're trained to think about worst case scenarios straight away. So naturally, before you have even actively engaged your brain, you might be starting to think of anaphylaxis. And what you have to do a little bit is you just have to rein that in, and you just have to focus on the key points in the question, like we said. So she gets a reaction every time she has a bee sting, but it's not until a few hours later. It's just an itchy rash, and it hangs around for a few days. So there's no mention of there's no mention of shortness of breath. There's no mention of circulatory collapse. There's no mention of any swelling anywhere. It's just a rash. So that is something that you should extract from that information straight away, and then have a look at the answers. So carry an adrenaline auto-injector. Because of what we've just explained, obviously, this is a delayed reaction, and it's not an anaphylactic reaction. So we can probably put that to the side. We have oral antihistamines and we have antihistamine creams. So them two can seem okay. Maybe these two are possible. Intranasal steroids, when the rash develops, you can probably put that away. Doesn't make sense. What are intranasal steroids going to do to a rash that's all over the body? Nothing really. How's that going to help? So we can discard that one. Call 999 for an ambulance immediately when stung by a bee. Again, because if you've read the question properly, if you've understood that this is not describing an anaphylactic reaction, you can probably put that to the side. So A, D, and E, we can probably put to the side straight away. Then we have to decide between oral antihistamines and antihistamine creams. So now what you're going to do is use a little bit of knowledge here. So obviously when you have what's being described is like an urticarial rash, which is all over, it's pretty widespread. Is it going to be sensible to use an oral antihistamine, or is it going to be sensible to use something topical? I would suggest that oral makes more sense. Of course, that's going to be more effective. This is going to be very itchy, very uncomfortable, and I'm sure topical antihistamine creams are not going to achieve that effect. And just one more thing is that she has severe eczema as well. There could be areas of her skin that are broken. There might be areas of her skin that are inflamed, areas of her skin that perhaps have a little bit of mild infection because she has severe eczema. You're not really going to want to be putting topical creams, which are not like eczema creams, on all this large area. So using that logic, using that extraction of information, using that, putting the questions that don't, the responses that don't make any sense to the side, and then a little bit of knowledge to decide between the two that seem sensible or appropriate. So this is what you have to do. Have to extract the information and then put the ones that are obviously wrong to the side. And this will happen often. You'll be left with one or two, or maybe usually no more than two, that you have to decide between. Remember, if you're taking too long, if it's taking too much time, just flag it and come back to it. Again, hope that question was useful. Let's move on to the next one. We've still got 10-15 minutes or so, so we should be able to get in another couple at least. Okay, fantastic. So statistics. Who doesn't like statistics and epidemiology? I'm sure these kind of questions are generally hated by most candidates. There'll be very few people who love these kind of questions, but it's even more reason for us to have a go and just share a few learning points. So let's have a look. A town has a population of 250,000. In a 5-year period, there were 1,000 cases of lung cancer diagnosed in that town. The neighboring town also has a population of 250,000, but only 400 people were diagnosed with lung cancer during the same 5-year period. Excuse me. What is the annual incidence per million of lung cancer in the population of both towns? So have a read, guys. Don't be phased. Statistics questions can seem scary, can seem complicated. Have a go. Thank you, Hafijuddin. Thank you, Fatima. Pop your answers down in the chat box. Take a minute if you need to read the question yourself, get that a bit more of an experience like you normally do when answering questions, and just pop your answers into the chat box. Fantastic. So we're getting a range of answers. Thank you, Manash. Anybody else who wants to have a go, please just drop it in there. I'll give you another 10 or 15 seconds. Okay. Thank you, Asfand. Thank you, Maz. Fantastic. All right. No problem. Thank you. Well done, everyone. Let's have a look, first of all, at the correct answer, and then we'll come back and dissect the question. Okay, so the correct answer is D, 560. So don't worry, guys. I can see that nobody got that one correct, but don't worry. These kind of questions can be difficult. Don't worry about it. That's why we're here. That's why we're here to help you and to show you how to tackle these. Okay, so let's do what we're supposed to do. Let's read the question first. Let's dissect the information, and then let's go towards checking the answers. So you've got two towns. Both have got populations of 250,000, and we're talking about a 5-year period. In one town, there's 1,000 cases. In another town, there's 400 cases, both in the same 5-year period. So in terms of irrelevant information, there isn't really any irrelevant information here. The numbers are there. All the numbers are relevant. The time period is relevant. And obviously the number of cases is relevant. And this is the key part. Now, read this part properly. What is the annual incidence per million of lung cancer? So notice two things: annual incidence, and remember it's given you the incidence over 5 years in the figures. So it's asked for annual incidence, and then it's asked for an incidence per million. Now, the populations of these towns are 250,000. The third and final thing is it's saying what is the annual incidence per million in both towns. Okay, so it wants you to, the question wants you to give the annual incidence per million of both towns together. So that's 3 key things in the actual final sentence of the question, and that is crucial. If you don't read that properly, if you don't notice it, you won't get there. Now, there's a couple of different ways to actually work this out. I'll do it. I'll explain how I did it, and then obviously, you know, as long as you arrive at the right answer, it doesn't really matter. So the incidence. Let's start with what is the. So let's start with the population first. You've got two towns, population of 250,000. Obviously, their total population is 500,000. Okay, so we'll just make a mental note of that. The second thing is let's add up the number of cases of lung cancer in each town. So one has 1,000, one has 400. So that's a total of 1,400. That's 1,400 cases in 500,000 population in 5 years. Okay, so here I noticed a couple of people put, or at least one person put B. So that's how you might have got 1,400. But again, it's asking per million in annually. So we've got 1,400 and then we've got 500,000. Okay, so we know that obviously in order to get to 1 million, we're going to need to multiply 500,000 by 2, and therefore we're going to have to also multiply the total number of cases by 2. That gives us 2,800. So I notice also that 3 or 4 people actually gave answer A, which is 2,800. However, again, as I mentioned, if you don't get all the key bits of the information from that final sentence, you will miss the correct answer. So you add 1,400, you multiply it by 2, because you want the answer per million, but that gives you an incidence over 5 years. And the question is asking you for the incidence over 1 year annually. So you have to divide that number by 5. 2,800 divided by 5 is 560, and that's how you arrive at the correct answer. So I hope that was clear. I hope that was straightforward in terms of the explanation. Key things again, it's the same principles. Read the question properly, highlight the key bits of information, make sure you understand exactly what it's asking you, and then have a look at the answers and then go from there. Okay, great. We've probably got time to tackle one more. So let's move on, unless there's any burning issues with that one. Let's crack on. Let me have a look at which one we'll do as a last one. Okay, we'll leave that one. That one's quite straightforward. That one is... Okay, yeah, let's have a look at this one. So, an obese 55-year-old man sees his GP for fatigue and daytime sleepiness. His wife states that he has excessive daytime sleepiness, snores loudly at night, and occasionally abruptly awakens. He denies smoking and he is a social drinker. He's a lorry driver. Examination of the oropharynx is normal. What is the most appropriate next step in the management of this patient? Options are A, advise that there are no restrictions on driving. B, advise to stop driving just lorries. C, advise to stop driving cars and lorries. D, advise to inform the DVLA. And E, discuss with the DVLA yourself. So take a minute if you need, have a read of that question, pop your answers into the chat box, and then we'll go through the same process again. So driving type questions, DVLA type questions, these can come up commonly. We'll explain about what you need to do and how you're going to extract the information from this one. Okay. Right. Thank you, guys. Couple of responses for A there. Anybody else? Another one for A. Thank you. E, discuss with the DVLA. Thank you. Any others? Please drop it in the chat box if you have a response available. Don't be shy. Right, just get that book in my laptop. Okay, another 10 or 15 seconds for you there to have a look. Okay, B, thank you. Thanks, Fatima. All right, brilliant. Right, let's have a look at the question. Okay, so let's go through the same process. You have an obese 55-year-old man sees a GP for fatigue and daytime sleepiness. Okay, seems like relevant. The wife states that he has excessive daytime sleepiness. That's just repeating what you've already read. Snores loudly at night and occasionally abruptly awakens. So this part of the question is suggesting certain symptoms to you. So you've got someone who's obese, he's got fatigue, he falls asleep during the day, and he snores very loudly at night and occasionally wakes up all of a sudden abruptly. So what kind of condition is this suggesting to you that this patient might have? Obviously, you're going to think of obstructive sleep apnea. Now, the next part, him denying smoking, him being a social drinker, is relevant to the story, but it's not really relevant to you in deciding on the correct answer. So you can kind of ignore that. He's a lorry driver. That's obviously important. Examination of the oropharynx is normal. Again, not really relevant to you in terms of asking in terms of deciding which is the correct answer, and the questions asking what is the most appropriate next step in the management of this patient. So what you have to decide, first of all, is there any, so obviously the questions are all about driving. Are you going to say there's no restrictions? Are you going to say stop driving lorries? Are you going to say stop driving both cars and lorries? Or do you need to get the patient to inform the DVLA, or do you need to discuss with the DVLA yourself? So lots of stuff to actually get through and decide in this particular question. So there are two aspects to this question that you need to be aware of. Number one is safety. Okay. When it comes to driving, safety is always paramount. Now, are there any concerns about somebody who is driving who falls asleep during the day? Of course, there's going to be a concern about that. Somebody's very tired. Even if they're not falling asleep, if they're extremely tired most of the time, they may fall asleep. Their concentration is going to be affected, and they're not going to be able to drive safely. That's number one. Number two is you've got someone who is driving a lorry. So this is obviously a higher class vehicle in terms of a heavy goods vehicle compared to a car. Now, why is that important? So that is important is because not only is there safety concern about the person themselves driving a car, but there's also a concern with a heavy goods vehicle is that they are putting other people at risk on the road as well. So, of course, that is also the case when you're driving a normal car, but the risk is higher when you're driving a heavy goods vehicle because you've got something that's much bigger, much heavier, and could do much more damage. So, two aspects of safety to consider there. Now, the third thing is knowledge of when the DVLA need to be informed in this particular kind of scenario. So there's three actual things that you have to be aware of and you have to kind of work through and decide. So let's have a look. Okay. So in terms of safety, are we going to advise him to are we going to say that there are no restrictions on driving? Remember what we said about safety. We've said somebody falling asleep during the day could fall asleep at the wheel. Even if he doesn't fall asleep, is extremely fatigued, extremely tired, putting himself and other road users at risk. So can we say there are no restrictions? I would say no, we can't. So we can put A out straight away. Are we going to advise to stop driving just lorries or stop driving cars and lorries? Let's come back to them too in a second. Actually, no, it makes more sense to do them now. So are we going to advise to stop driving just lorries or cars and lorries? So think about this one, guys. If someone's driving a lorry, obviously, as we've said, the risk is higher. But if someone is driving a car, obviously, there is still risk there as well. If you're worried about one particular form of transport, you know, the concerns are going to be the same on the other. So this should help you decide between B and C, which of them two seems more sensible. The final thing you need to know about in this particular question is what is the DVLA advice about obstructive sleep apnea, who needs to inform them, and when. So this part is when the knowledge bit comes in. So just to give you a bit of information on that, so what you need to know specifically, and again, you won't know this unless you just know it, is that the DVLA only need to be informed if, and this can be done by the patient, doesn't have to be done by yourself. We'll come back to that in a second as well. Only the DVLA only need to be informed if there's moderate or severe obstructive sleep apnea, or there is mild obstructive sleep apnea with excessive sleepiness that is not controlled within 3 months. So two specific criteria where the DVLA need to be informed. Now, obviously, this person has come to the GP. They haven't been referred to the sleep clinic. They haven't had a diagnosis yet. We don't even know if they have a diagnosis of obstructive sleep apnea. So the DVLA thing actually gets taken out of it in this particular scenario. Now, there is a clause to that, and that is that if in real life, if you were to advise a patient to stop driving cars or lorries, and they said, okay, that's fine. We're fine to take them at their face value, and we don't need to tell the DVLA unless there is a specific requirement, like, in this, when there's moderate or severe obstructive sleep apnea or in a particular condition, etc. However, if the patient then tells you that they are not going to stop driving, or you get some information that that suggests to you that they are still driving, then you may be obligated to inform the DVLA because they haven't followed your advice. So D and E are taken out because DVLA is not yet in the picture because he hasn't even got a diagnosis. The question doesn't say anything about the patient, indicating that the patient is not going to follow your advice or anything like that. And so we're left with A has been taken out already. We're left with deciding between B and C. And as we said, it doesn't make sense to say to somebody, just stop driving lorries, because that's the higher risk. Obviously, if they're driving a car, there's still risk associated with that as well. So that's why the correct answer is C. Now, obviously, guys, that was a little bit of a wordy explanation, but I just wanted you to understand the particular issues with this question. It's about safety. It's about knowing that this hasn't been diagnosed as obstructive sleep apnea yet. The first step, as well as discussing safety, is going to be referral to the sleep clinic. And obviously none of that information is there for you. And so the DVLA part, and there isn't anything in the scenario suggesting that the patient is not willing to stop driving or anything like that, because that might be a different type of question. And so you can remove these few options and focus on which one are you going to decide between B and C in terms of just lorries or cars and lorries as well. Okay, so hope that was useful. I hope discussing them questions were useful as well. I think we'll probably, guys, to the team, is that, shall we pause there and allow people to ask any questions or put the questions in the chat box? Is that okay? Somebody from the team, can you let me know? Okay, yeah. So the team are saying let's pause there. So just before I do, sorry, Fatma. Okay, so just going to give you a quick summary. I almost forgot that I've got a couple of other slides. So just to quickly summarize, PLAB 1 success, what does it require? It requires relevant, up-to-date knowledge. We've already said that. It requires practice, but focused, beneficial practice. It needs the two of these things to work together, and then it needs good exam technique added in there to help. So Hive, that's what we're here for. Obviously, we've already mentioned, but everyone who's registered on the webinar, we're going to send you details on Monday about how to get access to our question bank for free, to give you an idea about our resources. Just final thing I'm just going to mention is about our premium PLAB 1 package. This covers all the things that we've discussed in the webinar about preparation, about practicing, about analysis. You have access to us. There's live teaching sessions. There's a complete video and audio course. There's 10 mock tests. And there are 250 digital flashcards for rapid revision as well. So it covers all the kind of learning styles. Do check that out on our website, and do ask us any questions about our services if you do have them. I'm just going to hand over now to either Fatima or Dr. Akidat. Just one final thing, we do also have an all-in-one package. So if you haven't started your journey yet, you've not even done your English, you want help with all of the process, English, PLAB 1, PLAB 2, visa application, even accommodation when you come to the UK, post-PLAB, once you pass, we'll help you with with mock interviews, with sorting out your CV. That is also available as well. We also have an all-in-one package. So do get in touch, do ask questions, do ask about our resources, do participate in our webinars. I really enjoy doing these, and it's fantastic to be able to help everyone and give them some pointers. So thank you very much to everyone for attending the webinar. Thank you for your participation. It really makes it much more interesting. Just going to hand over now to Fatima or Rakidat, whoever is available, to please just ask if there are any questions. Do pop any questions in the chat box as well, or just unmute yourself or put your hand up and we'll be happy to answer them.
If anybody have questions, you may ask.
Okay, I can see there's still a few people around. So, if you have any questions, all right, okay, brilliant. So we've got one question from Mars. Subjects to focus on mainly. So Mars, I think if I understand your question, you're asking which subject should you mainly focus on. Now, Mars, thank you. It's a very good question. Thank you for asking it. I'll try to answer it as best I can. So remember what we said right at the very beginning. PLAB is a very big curriculum. If you get a chance, go onto the GMC website, have a look at the GMC PLAB blueprint. You will see how big that document is. It's actually like an Excel sheet. It's really awkward to kind of go around and to actually use, but it gives you an idea of how big the curriculum is. What are the things that you need to cover? And so it's a massive curriculum. You can't really just focus on one part, Mars. What you have to do is you have to go through that plan, study, practice, analyze cycle that I mentioned, and you're only going to you need to plan for the whole curriculum, because there are certain parts of the curriculum that you can just put to the side and leave. You can only do that if you actually look at things, you plan, you study, you practice, and then you feel, okay, these are on this particular area of the curriculum, or this body system, or this specialty, cardiovascular neurology, whatever, I feel quite strong. Then you can probably kind of take your attention away from that a little bit and focus on the ones that are weak. So focus on the ones, the questions that you're not doing so well on, and then go back and study them. So it's a very individual thing. I can't say to you specifically, obviously for yourself, Mars, we haven't spoken. I don't know what your strengths are. I don't know what your weaknesses are. Feel free to get in touch. We can have a chat, after the webinar, early next week, whenever, to actually discuss your particular weaknesses and strengths, but it has to be individual for each person. So for you, it might be something, for someone else, it might be something else. You need planning, you need to study, you need to practice, and then you need to analyze your weak areas and then focus on them. I hope that helps. If there are any other questions, please feel free to pop your hand up, unmute yourself, or drop the question in the chat box. I'll give you another minute or so. So we always say the same thing. There's no questions. So either everybody understood everything, everyone knows everything about PLAB, or nobody understood anything at all. So I don't know which one it is. Sometimes people are a little bit shy, but don't worry. If you don't want to ask your question here, we encourage you to ask it here, because it's helpful, because then other people can benefit as well. However, if you don't want to ask it here, if you want to approach us, if you want to send us a message, get in touch. We can have a phone call with you. We can give you a free consultation, either myself, Dr. Shakil, one of the other members of the team, and we can discuss things then. So thank you, Hafizathin. You've already contacted, no doubts for now. Thank you so much. Thank you for attending. Thank you, Mars, for asking your question as well. I think that means that if there are no other questions, then can I pass over to Fatima to just wrap up? And remember, guys, the messages, they're all in there. You've got our details. Visit our website. You know, get in touch, and we will contact you guys early next week to tell you how to access our the free access to our question bank. So, Fatima, over to you, please.
Thank you so much, Dr. Umar. So that concludes today's webinar. Thank you for joining us today. We appreciate your participation and hope you find the information helpful. Thank you so much, everyone.
Thank you.